Hi, this is Greg Sill from HealthCatalyst. I'm excited here to work with the Betsy product to show a couple of the applications that we have built. Specifically, we're going to start here with our HCC Insights tool. As many of you know, HCC scoring, or the hierarchical condition categories, are a way that we can look at and assess the risk of our patients, and specifically as we look at-risk agreements. This is one of the ways in which organizations judge our ability to address those risks and also look at risk adjustment factors. So it's very important for an organization to be able to understand the risk of their patients and be able to manage and monitor that. And this application provides you that high level understanding of where those opportunities are to address that particular condition. And basically what we see generally across the data is there's two different activities that impact our ability to correctly adjust the risk. And that is from an access perspective, are we able to see these patients? Are they able to come in and have services in which that we can code their evaluation of their particular risk? Or on the second thing, that we have seen these patients over the last year, and for some reason or another, that they weren't correctly coded, that there was not an evaluation done of their chronic conditions that would ultimately impact that risk. And so therefore, this application takes each of those into consideration and calls that an opportunity. And you'll see over here on the right-hand side that we take each of those conditions from the HCC scores, and we calculate how many patients have an opportunity or a chance to affect their overall score by correctly coding their particular condition, what would be the total opportunity or the total impact on our score based on that, and then from that, how many patients or how many cases is remaining. And this allows us then as an organization to really focus into those areas. And so it may be specifically that we reach out to a group of patients, maybe this first category, with specified heart arrhythmias. But generally what we see, especially with health centers, is we want to focus in on the individual providers and what they can do to help affect their patients. And so by going further into this application, into Provider Insights, we can see a list of our providers, and then each individual provider may be able to look at their particular overall performance. And so as I've selected a provider here, you will see overall my score has increased over time, but I still down here have a few opportunities that I may want to focus in on. And so to help me with that, my next tab gives me those list of patients that I can look at and focus in on. And particularly if I look at an individual patient, I can see their particular scores over time. So focusing here on the bottom left-hand side, I can see that this patient has progressed with different conditions over time. However, I can see that there was a drop-off from what they were previously identified to what their current benchmark year is. And so what that allows me to do then is identify, looking back in history, what are some of the conditions in which that patient previously was identified for, and what would be the impact on their score if I had had the opportunity to evaluate that patient and correctly code that out for that particular case. And so in this case, we have about a 0.8 point score that would bring their current score from a 1.2 up to a 2.092, which ultimately may impact. And it may not be that big of an impact per patient, but as you look at your collective group of patients, that may become very much more important for you. In addition from that, if I clear that particular patient, we can also look at overall coding distribution for the patients that were treated by that particular provider. Where are they seeing different services across the different network as well? And within that network, if I look at an individual provider, we can see what they particularly coded as well as the overall population. So here we can see there's about a 20% population of diabetes, but however, this provider hadn't seen anybody that was a diabetic throughout that time period. So this may be an opportunity. I know this is a short look at some of the ways that we look at HCC scores, but I hope this gives you some insights of some of the applications that you can use within the Betsy product to help manage some of your conditions and patients that you serve. Thank you very much for this, and we'll talk to you later.
Welcome to the Betsy Project collaboration with HealthCatalyst. I'm Matt Cuccini, and I'm here to show you some of the tools that our team has developed with the Betsy Project to help you and your health center be successful. The Leading Wisely application is a web-based visualization and information sharing tool for leaders of all types of healthcare organizations, including FQHCs. It is part of our Rapid Response Analytics suite, which means that it ties in really well with Population Builder. As you can see, what I have right now is a cohort that I created within Population Builder. I saved it, And now I'm ready to launch into Leading Wisely to visualize it. So what it will do is pop up a dashboard showing some key metrics that I defined previously. What I want to show you today, however, is more of the information related to the Health Center CFO's interests. Self-service dashboards that you can build in Leading Wisely can be customized to show current performance and performance over time on whatever measures are important to you and your team. There are a number of different charts and graphs and data science forecasts that can be added to enrich the insights that you get out of your data. So as you can see here, we have a number of different visualizations. What we see in these lines to the right of the graphs are the data science forecasts. These dashboards can be shared, they can be exported, they can be printed to PDF for viewing outside of the application. And because we know that healthcare leaders are busy and they don't have time to check numerous dashboards every day, this tool can be set to alert you when something you care about needs to be checked. So you can set the alert threshold, you can set how you want to be alerted, and then you can rest knowing that you'll be called when needed. So the example that I'm talking about here is just where a CFO of a health center was unable to compare key volume and revenue metrics because of different locations using different definitions or not collecting the data at all. What he did was he used Leading Wisely to develop a dashboard of some standardized measures that he could monitor daily, allowing him to address performance issues before month's end. And he was actually able to replace 2 reporting systems, saving more than 500 hours annually. This application we intend for executive leaders and administrators and healthcare analysts and basically anybody interested in healthcare data to use. So please see the longer video that we have on this tool if you want to find out more details, if you want to see more of the features. And I would invite you to continue working with the Betsy project. We look forward to working with you and sharing these tools with you and your center to help ensure your long-term success. Thank you. Hi, and welcome to the Betsy project collaboration with HealthCatalyst. I'm Matt Cuccini, and I'm here to show you some of the tools that our team has developed with the Betsy project to help you and your health center be successful. The PMPM Analyzer Analytics Accelerator provides claims-based data and visualization to support a holistic evaluation of the drivers of PMPM payment performance. This tool gives an in and out-of-network view of payment trends and gives users the ability to understand how an ACO's providers, members, and specialty areas are contributing to overall PMPM payment performance. So with most of the accelerators that we build at HealthCatalyst, we start off with a summary tab to show the high-level summary data that an executive might be interested in. Immediately, comparisons can be made between different at-risk contracts. And then starting to drill down into some of the numbers, we can see trends over time. We can see for any number of these 18 metrics, how they do over each quarter. We can also see the attributed providers or PCPs, for example, who are contributing to these numbers. And then getting into payments, you can start to see how your overall PMPM is doing. And then if you want to drill down into a specific patient subset, you can do so here and see, for example, how much PMPM your diabetics are contributing to the overall PMPM. We also enable you to get a view of the network leakage. So just by choosing to see those who are not network providers, you can get a sense of where your members are going outside of network to get care. Additionally, too, you can see measures of utilization. So if you want to see who are the members going to the ED quite frequently, or who are having a lot of encounters. These are the people that you might want to impact if you can put together a program to do so. What we generally try to do at HealthCatalyst is provide those high-level summary numbers that your executives are interested in, as well as the low-level granular details that your analysts are going to want to drill down into. So when a trend is identified, when something necessitates further investigation, an analyst can come in here and get the details of the members, get the details of the encounters to start to do root cause analysis and find out what improvements can be made in the system so that they can get the improvements that they desire. To give you an example of how another organization has used this tool, there was a health system that entered into a shared savings agreement with a payer, and they wanted to understand how its providers were performing against per member per month targets. So using PMPM Analyzer, the executive team was quickly able to see that for the past 3 months, PMPM payments trended below the target, but that there was another worrisome rise in spend over the last month. So the CFO asked her analyst to explore this trend and identify opportunities for improvement. Using PMPM Analyzer, the analyst determined that out-of-network service leakage for cardiology had been one of the major drivers of those rising costs. And in response, the leadership team was able to consider options for better aligning with those specialists. This application is intended for the CFO, for financial analysts, for the population health management team, and other users. Please see the longer video that we have on this tool, PMPM 2.0, to learn more about how it can help you and your center. The Betsy Project looks forward to working with you and sharing these tools with your center to ensure long-term success of your organization. Thank you. Hi, and welcome to the Betsy Project collaboration with HealthCatalyst. I'm Matt Cuccini, and I'm here to show you some of the tools that our team has developed with the Betsy Project to help you and your health center be successful. The Population Builder application is part of our Rapid Response Analytics suite. It is a visually oriented application that allows users to define populations quickly without having to use sophisticated or customized structured query language or SQL coding. Through rapid ad hoc analysis capabilities, Population Builder enables organizations to reduce analyst workload and increase analytics productivity. Analysts can leverage Population Builder's reusable elements such as value sets and populations to improve data governance and consistency. To give you an example of how this has been used at another organization, a quality improvement leadership team at that organization needed to define and identify high-risk cohorts that needed targeted intervention in the coming year. For example, potential opioid abusers or patients with severe persistent mental illness. The team worked together on this tool to define these populations based on multiple regulatory and operational criteria. So what I have here showing on the screen is a population that I quickly built by dragging a few of these filters onto the work pane. And you can see that I'm searching for patients of a certain age who do not have diabetes, but who do have hemoglobin A1C scores suggestive of diabetes. And just to make sure that it wasn't a fluke, I made sure that these scores occurred at least twice. You can see here that there is some pretty sophisticated querying abilities that you can just do visually with these drag and drop tools. So you can see how the population dwindled as I applied more criteria, and I ended up with 13,400 patients. Now immediately what I can do is start to explore who these patients are. I can start to see their names, and if I want to do some quick and dirty analysis, I can get some histograms of their gender or their race breakdowns. Now, what we also really think is powerful in this tool is the DOS chart. So just by clicking on one of these patients, what I can see is all of the information in the data operating system, information on demographics and labs and diagnoses and encounters, all right here. So I don't have to go and hunt around in the EMR to try to find this. The other thing too that's really great about this is that you can interact with the population you just created inside of Leading Wisely. So I can hit this button and it'll launch me into that tool to do more sophisticated visualization building. What we really hope to achieve at HealthCatalyst is that through this tool, users who are not analysts can get into the data themselves, answer their questions immediately. They don't have to rely upon analysts to work through their analytics backlog and get to the report request eventually. When users are able to answer their questions off the bat like that, it helps them keep their train of thought going, and it helps them get along with their research and with their improvement projects. This application is intended for clinical analysts, financial analysts, researchers, clinicians, and care managers, and essentially anybody who's interested in interacting with their data. Please see the longer video on this tool, which will show more demo data, more live data blurred out for patient confidentiality for your center. The Betsy Project looks forward to working with you and sharing these tools with your center to ensure long-term success of your organization. Thank you.
Hello, I'm Greg Sill, representing HealthCatalyst and also the Betsy Project, to share with you some of the tools and applications that you have access to help manage your organization. And specifically, today we're going to be talking about the Revenue Cycle Explorer. As with many of the different activities that you have within your organization, there's key metrics that we need to track in order to be able to manage the different processes that you have. Here in Revenue Cycle, some of those key metrics are: what is my total AR? What is my current days that I need to look at, specifically to help close some of those open accounts, as well as some of the collection activities around that. So we start with our application at a very high level executive summary. What are the different KPIs that I need to focus on? What are some of the trends that could instantly direct me to some of the areas that I need to focus on? And then once we have looked at that information, that's going to direct us to a couple of activities that we may need to focus on to specifically manage our AR. The first of that may be just simply a management capability of understanding which accounts that we need to work to help close out some of the open AR accounts that we have. And so the first analysis within this application is looking at that overall AR management. We do this by looking at different dimensions of the data against the metric of what needs to be collected. And so here in the dimension categories, I may start with a analysis where we start with, let's take a look at my top locations that have open accounts. And so I'm going to select those using the tool here. And then we may look at other things, such as what was the payer that was associated with that. We notice that most of my open accounts were self-pay. So maybe we want to focus on maybe the next step down, which is my Medicare accounts as well. And then we can look at the open accounts by provider or other different dimensions to help filter down that further. Also, by looking at the overall categorization of the balance of those accounts, we may identify a particular group of accounts that we may want to focus on. This may either be driven by the number of accounts or the percent of the AR that those accounts represent. And so we can see that this 10,000 to 50,000 is almost 30% of our AR. So that may be something that we want to focus on. And then by selecting that as well, the ultimate goal here is that I want to know now the list of accounts that I need to work. And so I have now built myself a work list that these are the accounts that I can focus on. I can very easily publish that list to an Excel document if I need to look at that in further detail, as well as I can use this to drive through some of those accounts to help clear out those chart of accounts. Another aspect of this application as well, though, is managing my denials. And let me clear the previous filters there so I can see this particular information. So another key aspect of my AR management is understanding where are the denials coming from, what is the cause of that, and being able to very quickly address those and understand that particular process. And this may be driven by simply a provider calling up your department saying, where are my denials? Why am I getting so much denials? How can I affect that? Or it may be from a more operational function. Where's the areas that we need to automate some of these denials so we're not having to spend extra effort on that. And the way that this actually works is I can take any of these denial categories here. I'm going to just take this coding and abstraction category. That's going to, just as you saw with AR management, be able to drill into the details behind that. So looking at my billing errors, my coding, my deny days, and so forth, and we can look at the individual remit codes. But ultimately what I'm getting to, once again, is where is these denials happening? And so I'm going to look at the provider and expand that up, and I'm going to look at over the last 12 months, just by simply sorting the chart here, is look at those providers that have the most denials on that. And then by selecting those providers and minimizing back that chart back down, we can now see the different codes, as well as specifically the remit codes that were qualified for those particular providers, and being able to, once again, get to the list of denials that I need to address for those particular providers. This is just a very brief view into this application, and I hope this gives you enough information that may be of interest to find out more information. Thank you very much for watching this demo, and we will talk to you later.